Good afternoon, everyone. I think most of you were present in the last class of the ADR reporting. Okay. So today we will see that whether you are able to do the or solve the reporting by yourself. Okay. So today we will be giving you some cases based on that you have to report the ADR. Okay. First, do you remember the casualty assessment part? How we have divided according to the cases, and in which cases you have to write certain or possible or probable. Do you remember? Okay, so how will you say that the case is certain? How will you say? So let us go into that casualty assessment slide. Here in the first box there is the certain. Okay, so do you remember when I said the three terminologies in explaining this assessment? First was challenge, second was re-challenge, and third was re-challenge. Okay, what is challenge? Don't remember? Challenge is when we primarily introduce a drug into a person. Okay, that is known as challenge. Okay, when we withdraw or stop the drug, okay, that is known as de-challenge. Okay, de-challenge. Okay, and again, suppose an adverse reaction has occurred to the patient. Okay, that time after the de-challenge, if we reintroduce the drug in the same route with the same dose and the same event adverse reaction has occurred, that is known as re-challenge. Okay, so with these three terminologies I have explained it to you that if you have to classify a case of certain. Okay, let me give you an example so that it is clear to you. So the case was a tuberculosis patient, okay, has been given the anti-tubercular drugs, the rifampicin, isoniazid and pyrazinamide. Okay, so it has been seen after a few days there is elevation of the liver enzymes. Okay, so the physician stopped the drugs. Okay, and first he stopped the rifampicin, then the isoniazid, then the pyrazinamide. Okay, then again he introduced to see which drug was causing the inflammation in the liver. Okay, first introduced again rifampicin. Okay, there was no inflammation. Second, again he introduced isoniazid, no inflammation. When he introduced the pyrazinamide, that time again there were signs of hepatitis or elevation in the liver enzymes. So this is a case of certain because the patient primary drug was introduced, all the drugs were withdrawn, again the causing drug was introduced. So there was challenge, there was de-challenge and there was re-challenge. Okay, any confusion? Okay, so in the second criteria, when we go to probable, okay, one example is there. The patient of an old patient is suffering from benign hypertrophic prostate. Okay, he was given the drug Prazosin. Okay, after taking the drug Prazosin, he was feeling dizzy, okay, and vertigo. Okay, so when he went back to the physician again, so the physician changed the drug. Okay, but it was same group but a different drug. Okay, that time and the drug Tamsulosin was prescribed. Okay, after that the patient was not feeling any symptoms. Okay, he was well. So here what it is done? First the drug was introduced and the drug was stopped. So challenge was there, de-challenge was there. So it will come under probable. Okay, the second criteria. Okay, understood? In the third, challenge is there but de-challenge is not clear. Okay, maybe lacking or unclear. Understood? Information of the drug withdrawal, that is de-challenge is lacking or unclear. Okay, if the de-challenge is lacking or unclear, then it will come under possible. Okay, any confusion in these three? Okay, so with these three you have done you have solved two cases and you have reported the ADR. Okay, now try to solve the other problems. Okay, so this case and this case you have solved, isn't it? So today try to solve this case. Okay, Let us see you can do it or not by yourself. Start. It is visible clearly. Which part you want to zoom? The upper part? So let me read it for you, okay? A 35-year-old woman, Anita, was prescribed tablet amoxicillin, okay, for urinary tract infection. After taking the medication for 3 days, she developed widespread rash on her torso, arms, legs, itching and hives, swelling on of the face and lips. Adverse diagnosis: ADR is allergic reaction to amoxicillin, and in management, immediate discontinuation of amoxicillin, administration of antihistaminics, topical steroids, monitoring signs of anaphylaxis. After 2 hours, the patient became alright, but remain admitted for the next 3 days for management of UTI. Okay. Keep the batch number as alpha numeric code. Okay. So in the batch number, you write the first 4 letters of the brand name and this current year. Okay. Like the first 4 will be AMOX 2025. Okay. Like that you write. Manufacturer date, write 3 months back. Okay. And expiry date after 1 year. And the onset should be yesterday's date. Okay. And date of recovery as per the question. This written na? Date of onset of symptoms yesterday. The last line, see? Others try to listen louder.
So patient initial is age. Age or date of birth is 35 years. Gender is female. Event reaction start date is
17, 12, 25. Okay.
Reaction stop same day 17, 12, 25. The reaction stop after 2 hours. 35-year-old female patient developed rashes on her torso, arms, legs, itching and hives, swelling of face, lips. Management was discontinuation of amoxicillin.
Okay, before going into the management, okay, your reaction stopping date was?
Reaction is that rash on her torso.
No. When did it stop?
17.
17.
2 hours later she became alright.
What did it say in the second line? After taking the medication for 3 days, she developed that, isn't it? So if the onset is yesterday, so she took the drug when? 3 days back, isn't it? Okay, so after 3 days, not 3 days back, after 3 days. So okay, then continue. So before the management, you have to diagnose the case, isn't it? So what you have written in diagnosis?
So she's having UTI.
Huh?
She's having UTI.
This is not the diagnosis. It is written, na? The diagnosis is allergic reaction to amoxicillin or amoxicillin induced allergic reaction. So this will be the diagnosis. Okay. Then after that you have to write the management. What is the management?
So management is discontinuation of amoxicillin followed by administration of antihistaminics and topical corticosteroids.
Antihistaminic. Have you written this? What is the antihistaminic? You have to write that. What is it written? Diphenhydramine, isn't it? For symptom relief, then
Topical corticosteroids for skin.
skin symptoms. Then
Patient recovered
and also monitoring signs for anaphylaxis. This will be the fourth. Okay, fourth one. Okay. Then
Patient recovered in ward or is still admitted forward.
no. So after that, this till this much is the management, isn't it? So you have to write till this much. Then what you've written?
These are written patient recovered in ward.
So this one you have to write in advice. Okay, in advice you have to write patient was admitted for the next 3 days for the management of UTI. Okay. Then in suspected medication, what you have written?
Amoxicillin.
Not amoxicillin. The brand name. Amoxil. Okay, write amoxil. Then manufacturer not available. You write NA. Then batch number. What I have told, the first 4 letters of the brand and this year. Okay, so Amox 2025, isn't it? Then expiry date. What you have written?
Sir, 2026.
Huh?
October 2026.
Okay. It will be October or
Sir,
which month?
exactly written.
Okay, it is not exactly written. What I have told, the manufacturing date is few months back. So you write 3 months back. Okay. So 3 months back it comes which month? September. September, isn't it? So September 2026. Then what about dose? Dose is not given, but it should be oral. Okay, amoxicillin. Okay. Okay, dose is oral. Okay, dose is not given. Okay, fine. Then frequency not available. Then therapy starting dates. Therapy starting date 15. So today is 17. So it will be 12, isn't it? It is 3 days. Okay, 3 days. Then yesterday was 17. Okay, 15, 14. Okay, 14. From 14 he started. When he stopped?
17.
Okay. Okay, then indication. It is not written. Why the drug was started? Yes, that is indication. Okay. So what you will write in causality assessment? Probable. Why?
It's written like life-threatening.
Life threatening. That's why. What is the reason? Why? What you have written others in causality assessment? Not written. Why? Because probable. Why? This is how I explain to you. Is this the way? I have given 3 terms, 3 terminologies. On the basis of that, I have explained the causality assessment, isn't it? First was challenge, second was re-challenge, third was re-challenge. Okay. If it is definite, then all the 3 should be there. If it is probable, the first 2. Okay. And if it is possible, then re-challenge is not clear. Okay. Only challenge is there. Okay. So what do you think? Challenge is there. De-challenge is there. Re-challenge, it is not there. So it is probable. Understood now? Okay. So it will be probable. Okay. Then action taken after reaction. Drug withdrawn. Okay, drug withdrawn. Tick mark that, and then others. Okay, give dash. Okay, then reaction reappeared after introduction. of the suspected medication is no. So write NA. Okay, not available. Information not available. Any concomitant medical product, whether the patient is taking any self medication, no. Give dash. Okay, all the things. Okay. Then 12 number point, any investigation? 12 number point, nothing is there. So NA. Any medical history? No. NA. Okay. So seriousness of the reaction? Hospitalization. Okay. Others agree with her? Others agree? Huh? Okay. Outcome? Outcome? Recovered. Okay. And the reporter details will be your details. Okay. Name, address, PIN, all the things. And date of report will be? Today's date. Okay. Fine. Okay. Let us do the next one. Okay. Try to do this one. It is visible? The lower part is visible, isn't it? Only the upper part. Okay. Upper part you have written. Should I repeat? Huh? So name of the patient is Kamal Kant Kumar. Age is 32. Male, 6 feet. Weight is 62 kg. Okay. Date of hospitalization is 2/10/2018. And diagnosis is essential hypertension. Okay. Then the general physical examination. Patient is healthy, oriented in time and place, no jaundice, JVB normal, heart rate 72 per minute, respiratory rate 16 per minute, temperature is normal, BP is 150/100. Systemic examination, respiratory system normal, CVS normal, past history, no history of allergic, no family history of diabetes or hypertension. Lab investigation is hemoglobin 16 gram %, TLC is 6000 per cubic mm, cholesterol is 200 milligram %, and the treatment is tablet Prazosin 1 milligram twice daily, tablet hydrochlorothiazide 25 milligram once daily. After 1 week of treatment, patient felt dizzy and fell down in the bathroom and sustained superficial scalp injury. The dose of Prazosin was reduced to 0.5 milligram after checking the BP in standing.
Age 32, gender male, weight 62 kg, given reaction 9, 10, 18, and
Okay.
19, 18, and even he felt dizzy and fell down in the bathroom and sustained superficial.
Not like that. How I have told you, how will you explain? How will you give the history? This is the event, you have to describe the history properly. So, how will you describe? Patient is a known case, okay, known case of essential hypertension, isn't it? And was treated, okay, and was under treated or under treatment tablet Prazosin, okay, 1 milligram BD, and tablet hydrochlorothiazide, how much? 25 milligram once daily. Okay, then what happened? After 1 week,
For 1 week of treatment, he felt dizzy and fell down in the bathroom and sustained superficial skin injury.
so this is the description of the event. Okay, you have described the event. Okay, now you will go to diagnosis. Okay, what is the diagnosis?
Adverse drug reaction due to essential hypertension.
How essential hypertension is diagnosis? You have given the patient was suffering from or is a known case of essential hypertension. This is not the diagnosis.
Sir, there is due to blood pressure that is 150/100.
Uh-huh.
There is, sir, hypertension, sir, because
Hypertension.
sir, blood pressure is increased.
Where?
That is 1/100.
After 1 week of treatment. This line? Where it is written? That is the vitals, isn't it? This part is the vitals. This part is the vitals. Okay. And for the essential hypertension, the patient has been admitted and was given these drugs. Isn't it? Okay. Was given these drugs. So after 1 week, the patient felt dizzy and fell down in the bathroom and got injured. Isn't it? So that time the reaction has occurred. Isn't it? So or the event has occurred. So the dose of Prazosin has been reduced to 0.5 after checking the BP at standing. So the BP, when they checked, it was 100/70. So do you think 100/70 is hypertension? So you can, what will be your diagnosis? What is the diagnosis? Hypotension, or you can write Prazosin induced hypotension or Prazosin induced dizziness. So this is the diagnosis. Okay. So after that, what happened? This is the diagnosis. Okay. Now what is the treatment you have given?
Sir, dose of Prazosin was reduced by 0.5 mg.
Okay. So this is the treatment you have given. Okay. Then
Then, in medical investigation in AIDS, can we write, sir, the
so after 7th number point, which point comes? Suspected medication. 8th number point.
sir, brand name hydrochlorothiazide.
Huh? Hydrochlorothiazide. Okay.
Then manufacturer is
Hmm.
batch number HYDR
20. This 2018 case, isn't it? So it will be 2018. Then expiry date unknown. Okay. Expiry date, if you write 1 year after, it will be in the 2019. Okay, 19. Then dose 25 mg. Okay. Then root oral. Then
frequency once a day.
okay.
Therapy dates started 2018
Okay.
and dates from 1980.
19.
1980.
Where it is written? Where it is written? Then why you are saying? What? They have not said anything about that, isn't it? So stopping date is not known. Then only hypertension. It is not given. Diagnosis. It is all the things are given, right, clearly and correctly.
Casualty is
Causality assessment. Possible. Why possible? Others, do you agree with her? Everyone is agreeing? Huh? Others? Others? Everyone is agreeing with her? Causality assessment? Possible. Because why? Because the D challenge is not clear, isn't it? That is why it is possible. Okay. Then
Next is Prazosin,
hmm.
where manufacturer is unknown,
Hmm.
and the batch number ERK is there 2018.
Okay.
Dose 1 mg,
Hmm. Expiry is 2019.
2019.
Then
Frequency 2 twice a day.
okay.
Date started to take
Okay.
18 and date stopped 9/18.
Again, whether it is given, whether it is given, what it is written, date stopped. Stopped means what? It has been stopped. It is stopped or not? It is not stopped. Okay. Then point number 9.
So drug withdrawn is Prazosin, which is not withdrawn but it is decreased.
So which one you will write? Why you are saying withdrawn? Okay. Then
By 0.5.
huh?
Reduced by 0.5.
Okay. Then
Sir,
reaction reappeared after reintroduction of the suspected medication, whether it was reintroduced, not introduced.
Sir, introduced by
Reaction, isn't it? Reaction was not there, so it is, reaction was there or not, so it is not there, so it will be unknown. Okay, so after that we don't know, so it is effect unknown. Then
seriousness of the reaction.
first is relevant investigation.
Sir, heart rate 72.
This is investigation. Then what you are saying, madam? Huh? Investigation. In investigation, do you write SBP? What is investigation? It is written, na? The lab investigations.
16 gram percent.
Hmm.
Protein percent 6,000 serum cholesterol 200 milligram percent.
Then why you are saying this side? You see in your paper. What you are saying here? What you have written, you tell.
Sir, hemoglobin 16 gram percent, protein percent 6,000 and serum cholesterol.
Then next.
And then relevant medical or medication history of allergy or kidney stone, diabetes and hypertension.
Okay. Then
Then seriousness of the disease is hospitalization.
so
Other medically important.
yeah, you can give that because the patient fell dizzy and fell down, isn't it? So if the patient fell down, okay, because if the patient fell down, then it can be postural hypertension also, sudden blockage of the blood supply in the brain, and also the patient there is sustained superficial scalp injury. So you can write as hospitalization, okay, because the patient fell down in the bathroom and there is an injury also, okay. Outcome is unknown. Okay. Then no, there is 16 number point. Reporter information. You have not written anything. What is your name? What you have written here? Okay, then. Okay. In occupation, student, medical student. Signature. What is the date? Today's date. You can give. Again, which part? Who have understood the causality assessment? No one has understood?
Because last class you didn't do performance.
But someone have taken. Why you have not? I have explained it to you. You are saying yes, and now you are saying again I have not understood. How will someone trust you? Huh? No one have understood causality assessment? You have understood? Not understood? No one. No one is in this class. What is that? So here there are many assessments, okay. So but we will focus on the first three, okay. The first one is the certain, isn't it? The second one is the probable. The third one is the possible, okay. So here what they are saying, the patient may be suffering from any disease, okay, may be under any treatment, okay. If the patient is under treatment, okay, and a primary drug has been given to the patient, okay, first, then some event has occurred, okay, then the drug was withdrawn, okay. So the first one, when the drug was introduced, it is known as challenge, okay, challenge. Then when the drug has been withdrawn or stopped, that is known as de-challenge, okay. So after that, due to some cause or any reason, that if the drug has been introduced to the patient by the same route, by the same dose, and the same event has been occurred, so that is known as re-challenge. Any confusion? Same route, same dose, same drug, and the same event has been occurred, then you can tell it as a re-challenge, okay. So if all the three things are there, that will be coming under certain, the first one, okay. And if the first 2 points, the challenge is there and de-challenge is there, so that will come under probable, okay. Challenge is there, but de-challenge is not clear, there is lack of information, okay. Like this one, this case, okay, essential hypertension case, okay. So that will be coming under possible, okay, understood? Any confusion now? This is the simplest, with the simplest way. Any confusion? Okay. So de-challenge means withdrawal or stopping of the drug, okay. So let us try to solve another problem. Okay, try to solve this one. It is clear? It is visual to last bench. Do it. Who has taken the last class? Don't know? You don't know the name of the teacher? New teacher? Fresh teacher? You have not seen him? Forgot the face. Bit short. He or she. He has not taken your classes prior. Then you can't say who has taken your class. See the condition. You have to know the name of your teachers first, okay? This is a very bad thing. You are coming to classes and classes has been taken and you have not identified the teacher, you don't know his or her name. The same condition was when you were in the first year. Till the end of your session, some of you still are unable to tell the name properly. When we were in our medical colleges, when we have taken the admission, on the first day it has been told you should know the name of all your seniors and from where they are belonging. This is very much for us at that time, and you people are not knowing the name of your teachers. See, this is a very big crime. Okay, this shouldn't be. Oh no, okay, you have finished? Okay. Others listen. Louder. What is the date? 2? 2? So you have to subtract 7 from 12, isn't it? So 7 from 12, what I am saying? 5, So it will be 7th. What you were saying, madam? Since last 5 days, isn't it? Since last 5 days he is having. So if you subtract 5 from 12, it will be 7. So date of event start, that is 7th. Okay. Then stop date. What will be the stopping date? It will be 19, isn't it? 19 December 2025. Okay. Then January. Okay. How will you describe the event? So if you okay, January, okay, it's fine. So how will you describe the event? How I have explained? First, whether the patient is taking any medication. For what is taking the medication? Psychotic attack or psychosis. Okay. So patient is a known case of psychosis and was under treatment, isn't it? And was taking the medication chlorpromazine. How much? Wait, what is the dose? 100 mg for 4 weeks, and also diclofenac for 50 mg twice daily. That is the self medication. Okay. Then he took that for 3 days, isn't it? Then
Sir, why did you mention abdominal pain, sir?
Huh?
Why did you mention abdominal pain? The patient was taking diclofenac because of abdominal pain, sir.
Yes.
Why did you mention this, sir, in the event? You just mentioned, sir.
Because the patient he himself was taking, no one prescribed that. That is the self medication. Then management. You have not explained this complaints. What complaint you are having? For abdominal pain. This is the way. How will you describe this? The complaints, the chief complaints are upper abdominal pain. Upper abdominal pain. So with this complaint he came. Okay, and nausea for 5 days. Then you have to write the GP also here. Okay, this is the main complaint here. Okay. Other than that, you can write here few psychotic attacks. Okay, for which he was taking this also. Okay, you can write that also. Then you have to write the GPE here. Okay, there is a general physical examination. So what is the findings? What are the findings here? It is written. This is the GPE. You don't know GPE, general physical examination. So this is the general physical examination. Okay. So with this you have to diagnose. Okay. So what is the diagnosis now? So you have also seen the this lab reports. Okay. I have seen that the alkaline phosphatase has increased. Okay. The ALD is also increased, and total bilirubin is also increased, isn't it? So now, what is the diagnosis? Hepatitis. Chronic hepatitis. Hepatic jaundice. So it will be because which is the causing drug? Which is the causative? For which the jaundice has occurred? For which drug do you think? Chlorpromazine, isn't it? Can it be diclofenac? Why? The duration is very less. He has just taken it for 3 days. It cannot, but it can aggravate. It can be aggravating. Okay, we have told you now what are the aggravating relieving factors. So it can be aggravating, but the causing agent is the which drug? Chlorpromazine. Okay, so it will be chlorpromazine induced jaundice. Okay, but if you want to clarify further, okay, what type of jaundice? So how many types of jaundice do you know? 3. One is okay. So if it is, whether it is hepatic or post-hepatic or pre-hepatic, how will you differentiate? With the lab report. So what does the lab report suggest? Hepatic. Okay. So in hepatic also there are 2, na? One is the obstructive and whether it is the only localized to the liver. Okay, so this is a type of mixed. Okay, it can be obstructive also, it can be hepatic also. Okay, so it is type of mixed. Okay, so next what did you do? Huh? Stop? Diclofenac. Okay, so you have stopped the medication. Okay, then what you have done? You have done anything? What you have done? After stopping the medication, we have waited for 7 days, isn't it? After 7 days, we have sent the investigation for repeat investigation, isn't it? Lab reports. So, any difference do you think? Okay, there is a difference. Okay, so these lab reports you have to write. So, whether you have written or not, where you have written? Relevant investigation. So, you have to mention the date there. Okay, did you mention the date there? On which date the investigation was done? First date is 19. First is 12. Okay, in 12 what did you got? So you have not written, you are looking here. Huh? No, so you have to complete it. I have asked you whether you have completed it or not. You have said you have completed. Complete means complete. It cannot be incomplete. Okay, in 12, what are the investigation? Then? Okay. Okay, so after 7 days, what is the date? Okay. 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 So what you have done next? Suspected medication. Okay. What you have written? Whether any brand name is given? So, what is the brand name? Largactil. Largactil, okay. Then manufacturer? Manufacturer is Wedley Labs. Then batch number? Okay, then expiry date is 2017, 2027. Then 100. Do this 100. Is it 100? See, dose is how much he was taking. He was taking 400 at a time, isn't it? So 100 multiplied by 4, isn't it? Total dose is 400. You can write 100 multiplied by 4 equal to 400. So to be more specifically, okay. Then root is okay. Then frequency is it is OD na once. He was taking 4 tablets. So it is not 4 times. It is once. At night time he was taking, isn't it? Then starting date is huh? $15? Is it 15?
It's 12
Huh? Then
12 is
why you are saying 15? Huh? अगर 4 वीक्स पीछे जाओगे तो कितना होगा?
to 1 month ago, na, sir.
4 weeks is 1 month ago. Then 12.
15.
Yes. Then stopping date 12 1 16. Okay. Then indication. Huh? What is the indication? You have already diagnosed it. Psychosis. Then casualty. Possible? Why possible? So it is probable. Okay. Then any relevant medical history? Any relevant medical history is there? So psychotic attacks we have already mentioned, isn't it? So any other thing? Nothing is there. Okay. So seriousness of the reaction is hospitalization. Then outcome recovering, isn't it? With the lab reports we can, it is visible that the patient is recovering, but he is not recovered. Okay. Then any concomitant medical product? Wait. Huh? Any medical product is, anything is there? Nothing is there? Really? Then why are you saying nothing? So you have not written in your this sheet? Not written, then why you are saying not there? So it is diclofenac. Okay, dose is 50 milligram. Route is huh?
50 into 2.
It will be 50, but in frequency of rate BD, isn't it? That one why I have told, because he was taking once. He was taking once, but he was taking 4 times the dose. That is why I have told you to mention 100 into 4 there. Okay. Then therapy starting dates. This one is this one. Okay. This one has been corrected, I think. Okay. Kindly correct with this 2025. Okay. The date. Okay. There will be 2025. Okay. So starting dates will be, you correct it. Okay. It will be 2025. Correct it with 2025. So the starting date will be diclofenac is
3 days.
There will be 9. 9 1 25. Okay. Stopping dates will be 12 1 25. Okay. And indication for that is, okay. So what is the date of report? What is the date of the report? 18 Okay, when you report, that will be the date. Okay, in the previous slides it was written yesterday. Okay, if you go yesterday, then it will be 17. Okay, let us stick to it. That okay, 17, 12, 25. Okay, any question, anything, any doubt regarding this? Okay, wait. The last one. This one is an homework. What is the time? More time is there. Let us see. Okay, it is an good one. Okay, let us try. Okay, there were six cases. Okay, for this class you have done only 3 cases. You try this. Okay, let us see. Let us see whether you can finish of your own. Okay, because I am helping you. Okay, let us see you try this of your own. Okay, let us see whether you can or not. This is an easy one, but this is a different. It is a bit different. Okay, let us see. Do it fast because you have already done 3. It shouldn't take much time. Okay, let us see you can finish it in 5 minutes. Let us see who can finish this case properly and correctly. Okay.
Age or greater than 30 years, gender male, weight 60 kg. Yes, the date of the action start date. So
12/12/25.
So 12 is 12th of December 2025. So the action start date same. So 14.
14.
14.
Which date? 14 December. Why it is written 14?
The last night of day 2, the infection with hypomycin was reintroduced at 9 p.m. Similar symptoms developed again.
So on day 1, once the reaction has happened and the drug, which drug was given? Phenyramine. Phenyramine was given, isn't it? So it got resolved. So they said it got resolved, so it will be, stopping date will be the same date. Once happened. Okay. On day 2 again, what happened? The drug was again reintroduced. Again the reaction was happened. So this is the day 2 reaction. So twice the reaction has happened. Okay, again similar symptoms for which phenylamine was given, again the symptoms resolved. Okay, so day 1 once happened the reaction, starting date, stopping date, same day. Okay, day 2 again, starting date, stopping date. Okay, so day 1 is which date? 12, 12, 20, 25. Okay, this is day 1, and day 2 is it 14? Okay, so day 1, huh? Given, हाँ हाँ, तो नेक्स्ट डे दिया, फिर से रिएक्शन हुआ कि नहीं हुआ? नहीं हुआ, डे 2 रिएक्शन हुआ था, रिएक्शन और नॉट रिएक्शन वाज नॉट देयर. हाँ हाँ हाँ, दूसरे डे पे दिया था, रिएक्शन हुआ कि नहीं हुआ? हुआ तो रिएक्शन स्टॉप हुआ कि नहीं? हो गया, तो दिस इज द डे 2 रिएक्शन. सो दिस विल बी ऑन 13, 14 or 13? 13. Why you are having confusion here? Day 1 is the first one when the dose was given. 14th होगा क्यों? Why you are confused? नहीं, because they have clearly said it ना, the day 1, the first day. On day 2 again the vancomycin was given. Any confusion here? No confusion. There shouldn't be any confusion here. They have said that the next day, first day they have skipped the dose, isn't it? Vancomycin second dose, see? फर्स्ट डोज दिया है, सेकेंड डोज दिया है? नहीं दिया है. हाँ, अगले दिन दिया है, तो नेक्स्ट डे 14 वेट सीजन
12 तारीख को फर्स्ट डोज दे दिया सर.
हाँ,
और फिर अगले दिन नहीं दिया सर. फिर इसका अगले दिन दिया तो 14 में क्या है?
he was injected following which the reaction completely subsided. Injection ceftriaxone was continued. However, next doses of vancomycin scheduled on day 1 were not given. हाँ हाँ, दिस वेंकोमेसिन का कितना डोज है पहले देखो. वेंकोमेसिन का हाउ मच डोज शुड बी गिवन इन ए डे? सी, देखो कितना लिखा है. सी, इंजेक्शन वेंकोमेसिन, द थर्ड लाइन, इंजेक्शन वेंकोमेसिन 50 milligram IV, how much? QID, what is QID? It should be, it is 4 times. It should be given 4 times. So next doses मतलब उसका डोज, क्योंकि सुबह को दिया था ना सेफ्ट्रैक्सोन 9 AM, 10 AM में वेंकोमाइसिन, तो नेक्स्ट डोजेस स्किप किया मतलब क्या है? जो उसका जो 3 डोजेस बाकी था वो स्किप किया. और so the next day, day 2 again given, again the reaction have happened. Confusion? Anything? Any confusion? Okay. Then so day 1 में reaction हुआ, day 2 में भी reaction हुआ. So both the days the reaction have been stopped. Okay, the same day. Okay, then now this way I have described the earlier 3 cases. You are just reading the lines. It is not a no, not this way. Whether I have said in the same way, I have described the event in this manner. How I have described? Why you are just reading the lines? You are presenting, suppose you are a doctor, you won't be presenting like that, na? There is a protocol, there is a system, how will you present? I have already told it to you. Batao. Nahi, no. कैसे रेस्ट्रिक्ट किया? The patient is a known case of bacterial meningitis and was under treatment or medication, injection vancomycin and ceftriaxone, isn't it? Okay, then on day 1 what happened? After first dose of ceftriaxone at AM and first dose of injection vancomycin at 9 AM. After 10 minutes of the second drug administration, patient started developing. Okay. So this is the description. Okay. Now what is the diagnosis? Meningitis? Huh? What is the diagnosis here? This is, which is the causing drug? Vancomycin. It is clear. Vancomycin is the causing drug. So it will be vancomycin infused reaction. Okay. Vancomycin infused reaction. This is the diagnosis. Now what is the management? Injection. Not given. Okay. On day 1, you have to, if you are saying like that, you have to write on day 1. Okay. Next dose of vancomycin was not given. Then in day 1 nothing was given. Cefizome. What is ceftriaxone? No, that is not the management. That is not your management should be what to the drug reaction. Ceftriaxone is not the management. So vancomycin, you have stopped it. Then what you have done to the reaction? Phenyramine, isn't it? Phenyramine, how much? 25 milligram. 25 milligram, how much? Intramuscular on day 1 and day 2, isn't it? So after that, that is not the, you have already said. You have already said, na? If you have to describe that, you have to describe it in the event, not here, not in the management. Okay. This part is over. Okay. After intense flushing, you can also say that the vancomycin dose was given on day 2 and again similar symptoms appeared. Okay. And in management, injection phenyramine, I am day 1 and day 2 given. Okay. Then suspected medication. What is the name? What is the brand name? What is the brand name? Benzid. Then? Okay. Expiry? Then? Frequency? Okay. Starting date is? Stop. But it was given on the first day and again it was given on the second day. So, stopping date will be second, 13. Then indication. Okay. Causality assessment. Huh? It will be. Why? Because the re-challenge was given, okay, by the same route, the same dose, and same event. Similar symptoms appear. That is why it is re-challenge. So it is certain. Understood? Okay. Then action taken after reaction. Hmm? Hmm. Dose reduced. 3 doses. It was withdrawn, na? It was withdrawn the first day, it was withdrawn on the second day also. Isn't it? So it should be withdrawn. Then reaction reappeared. Huh? Yes. Okay. Any concomitant medical product? Nothing. Okay. Put a dash. Okay. Relevant investigation? No. Okay. You write NA, not available. Medical history? Anything is there? What is there? Medical history? Then it is not available. Okay. Then seriousness of the reaction? Hospitalization. Then outcome? Recovered? Sure? Or not sure? Still? Sure or not sure? Okay. And date of this report? If it is yesterday, then 17, 12, 20. Okay, fine. Understood? Any confusion? Whether you will be able to do by your own self? Huh? Because all the 3 assessment I have given to you. Okay. You should be confident now.